Good morning, good afternoon. Welcome to the COVID Town Hall 2022. Hard to believe it's 2022 already. We are gonna jump right in so that we have time for questions. So Marco, I'm gonna pass it right to you for opening remarks.
Thank you so much, Sherry. How is everyone today? Can everybody hear me all right? I see some head shaking, so thank you for the confirmation. So good afternoon, almost noon, everyone. As many of you know, I'm Marco Giordano, your CEO, and I do thank you all for joining us today. And yes, Happy New Year, our first COVID Town Hall in 2022. So glad to see you all today. So over the past month, as we all have seen and heard and listened and watched and felt, the Omicron variant has resurfaced. Many of the fears and anxiety and burdens related to the certainties and uncertainties of COVID. And for others, these burdens have never been lifted over the past 2 years that we've been working through the pandemic together. And while we're reporting a significant number of cases across the country and within RHD, as Brian will share with us shortly, we are also seeing in most cases that vaccinations and other protocols are working to lessen the severity of the symptoms. The effectiveness of the vaccine and our protocols are resulting in a different experience than we had during the prior surges. However, we should not let our guard down. We must continue to adapt, to learn, and to adjust where we see we need to adjust. So I was reminded of a quote that I shared with you in early December when I had joined you last. A quote that often reminds me of Bert Wolfson, our founder who loved sailing and believed in possibilities. Here's the quote: "When you can't change the direction of the wind, adjust your sails." If you recall, this quote was from an inspirational writer, H. Jackson Brown, reminding us all that when we are faced with adversity, we do have the power to impact our path forward. So to that end, I recently have asked the executive team to consider how we normalize COVID. And I understand, as you hear me share the word normalized, that normalizing something that's been such a heavy lift and burden is not ideal. And I would agree, there are many aspects of COVID that we would never want to normalize. However, as the quote tells us, we cannot change the direction of the wind. But we can determine what we've learned and how to build upon those learnings, or how we replace the belts and suspenders and invest in a better fitting pair of pants, or how we normalize COVID like we have other things like bloodborne pathogens or the flu. For example, staying home when you're sick is nothing new. However, we now have an even clearer reason why we should do so. Rooted in this question of normalization is also a recognition of and the desire to lessen the heavy lift each of you have been asked to carry all during this pandemic. You cannot continue to do so, as well as you yourself be well and provide quality support to the people in our care and each other. So we have to figure out how we proceed. And I know that as I share this frame of thinking, that for some, this might be challenging. And I recognize that while we are all in the same storm, we truly are in different boats with different sails that we're trying to adjust. We've all been personally impacted and professionally impacted. And as we would agree in our industry, sometimes that there's a significant overlap between that impact. And the solutions might be complex. There might not be an easy answer. But we're RHD. We can deal with complex questions and getting to typically maybe even complex answer. I am certain that working together embracing our values along the way, that each of us has the ability to adjust the sail of our own boat and those of the folks that we're working with and supporting on a daily basis. So as we continue the conversation today, and as we continue to adjust our sails, I ask each of you to think about one question. What can you do? What can we do to realize the potential and possibilities of the year in front of us? With that, I'll turn the mic back over to Sherry. And again, thank you all for joining us today.
Thank you, Marco. So we've had lots of people join us since the open. And so Mary, if you could put up the agenda for a moment. So we're at the opening, we had the opening remarks, we're at housekeeping. And so the one thing that I do want to remind folks from a housekeeping point of view is that you can get a lot of information when you go to Lawson to the COVID section of the website. So that came up recently in a conversation. Just want to remind you that is one really easy way to access that information. And then, of course, we encourage you to submit the questions through your voice. We've already gotten several of those this morning. So Mary is manning that mailbox. There's the COVID-19 inbox, the Zoom chat, and then, of course, you can always use the raise hand. I will say we're on several screens, so sometimes it's hard to see the raise hand, so you can always put in the chat, I've got my hand raised, or unmute yourself. Brian will be taking us through the COVID numbers. June will talk about some of the updated protocols, and then Brian Joel will take us through the CMS OSHA update. And then, of course, we'll open it up for Q&A. We see that some Q&A is already coming in. It's just Mary and I today, so I will ask for your patience in getting through the Q&A, and then we'll pass it back to Marco to close us. So Brian, I am going to send it to you for the COVID number update.
All right, thanks, Sherry, and good afternoon, everybody. I'm going to change things up a little bit today, and I'm going to start by sharing my screen today. And I'm going to bring up that spreadsheet that we normally look at to share some of the numbers. Really what I wanted to do this time out was to focus on the last 2 weeks of data, because I think it really gives us a better feel for the current COVID climate. So, just by looking at the bar graph, you can actually see to the far right, you're going to see those really large bars, which shows the activity, and it's really been significant. So over the last 2 weeks, we've seen 361 reports, of which 145 of those reports were confirmed cases. So that's about 40% of those reports that came in as positive. So we see a lot of activity, and we know that nationally, there's a lot of activity as well, as Marco already mentioned. We're seeing these cases just rising exponentially. So what I wanted to do is just do a comparison today of last year at this time, because I think it kind of gives us a little bit of perspective. So this same 2-week time period at last year, we saw 201 reports come in. 63 of those were reported as confirmed cases. So, that's about 30% from last year of those reports that came in confirmed. So we definitely see that uptick. So overall, there are 79% more reports this year than at this time last year, and 130% increase in the number of COVID cases that were reported at this same time last year. So we really do see that uptick, especially over last year. So what does that really tell us? Well, it really tells us we saw a perfect storm of circumstances kind of combined to fuel the latest surge, both at RHD and nationally. We saw the Omicron variant, which Marco had already alluded to, and the gathering holidays. We saw those kind of come together, and that's really going to push those numbers. But I'm sure, and I know at this time last year, we talked about COVID fatigue. And if we were COVID fatigued last year, I mean, where do we think we are this year? We're probably in that same boat. And I'm sure that may have led to some relaxed safety measures, and not just at RHD, but nationally. People are starting to be a little burned out from COVID. So what does that tell us we need to do? And that's really get back to basics. We want to make sure that we're doing the things that we did early on in the pandemic to really try to drive those numbers down, which is washing your hands, wearing a mask, watching your distance, and waiting on gatherings. I know we had a little fun over the last few weeks doing COVID Corner, in which we really kind of talked a lot about doing those more basic things and really not just doing one of them, but doing all of them, layering in your protection. Make sure you're taking all those precautions together in addition to getting vaccinated. And I know that we've talked about vaccinations not even being 100% guarantee that you won't become ill, but really helping you, avoid the worst cases of COVID. So, we just want to make sure that we're doing our best to make sure that we keep ourselves safe and to make sure that we're doing our best to not spread COVID to our friends, families, and the people that we serve. So with that, thanks everybody. Continue to be safe. And I am going to now send this to June Hodges to talk about protocol updates. And there she is. And I'm going to stop sharing my screen right now so you can see all of June. There you go.
Thank you, Brian. Hello, everyone, and Happy New Year. As you all know, and as Brian mentioned, and Marco too, cases are on the rise. We've seen this on the news. Considering this, we're stressing the need to be vigilant, though I'm sure we're all tired, as Brian also pointed out, of the virus and its variants. The CDC has once again changed its guidance as of January 6th. The changes made include revisions to quarantine and isolation protocols based on the science observed in the last 2 years, and noting that people need to engage in basic life activities. We have revised our protocols as well, with the interest of creating a safe residential and work environment for our clients and staff based on this guidance. And again, without undue hardship, where we can make changes, the CDC is recommending that we do. These adjustments to the COVID protocols do not replace regulations in several states or locales that relate to entering public and private workplaces that may be more stringent. They are the CDC guidelines that now address staffing during periods of shortages, yet still relate to those necessary steps for programs to take to minimize the spread of the virus at RHD programs, particularly as we continue through the winter. We will be releasing final version of the COVID-19 protocols at the conclusion of this town hall. And at this time, I just wanted to point out several of the changes. The definition of fully vaccinated has been revised. If you receive the 2 shots of Moderna or Pfizer vaccine, and it is more than 6 months, or 1 shot of the J&J vaccine, and it's more than 2 months, a booster is required to be considered fully vaccinated. Note that the quarantine time period for vaccinated versus unvaccinated persons directly exposed to a COVID positive person has changed to 5 days. Vaccinated persons no longer need to quarantine, but can work masked, yet monitor for symptoms, whereas unvaccinated persons should quarantine for 5 days and monitor from symptoms. And if no symptoms after 5 days, continue to work with a KN or N95 mask for an additional 5 days. They may switch at that point to these regular surgical masks thereafter. Asymptomatic persons, that persons with no symptoms, but testing positive, can work mask wearing KN N95 masks after 5 days quarantine, even if testing positive thereafter, unless they develop symptoms. No one is to work if they have symptoms of COVID-19, and those are expressly stated in our protocols. There's a whole list. Whether or not they are mild symptoms, people must be symptom-free for 72 hours without the aid of medication to return to work. Following all COVID-19 protocols protects our clients and staff at each program site from contracting COVID-19. Remember now that KN95s or N95s are being required to continue working at programs if exposed. And then it's more important than before that the PPE 3-month emergency supply requirement for programs is considered and monitored, and that stock for other supplies as well is checked, hand sanitizer, bleach, etc. With winter stretch still ahead, we also want you to consider some of the safe options for activities in our protocol document too. And there's some fun things to do to make the winter months not drag on. We posted a revised protocols copy on the COVID-19 site that is being sent out today for your handy reference. Stay well, stay safe in 2022, and thank you. Now, I guess I'm handing off to Brian Joel for CMS and OSHA update. Thank you.
Good afternoon, everybody. So there's been some updates as it relates to the CMS and OSHA mandates. I would like to first give a brief summary of where we are from our prior town hall. From our prior town hall, CMS and both CMS and OSHA have been enabled to implement both of the federal mandates. CMS, as I've stated in our prior town halls, it has been confirmed that is only going to impact FPCN. As it relates to OSHA, which mandates that organizations that are 100 or plus more employees, they must either implement a vaccine mandate or a testing and masking option. Both of those mandates were deemed effective by a federal appellate court. Since then, and this past Friday, there was some more confusion into the mix. The Supreme Court has held oral arguments to decide whether it's going to implement another stay on the OSHA mandate or implement a stay on the CMS mandate. So it's still in flux. There's still a lot of moving parts that are going on here. But what I will say is that there are early impressions, and the early impressions are that the CMS mandate will but the impressions are that the OSHA mandate, at least in the form that it's drafted in now, may not be able to, and they will issue a stay on the OSHA mandate. That all being said, as we know, we do have local and state vaccine mandates that are in place. We still, with the influx of what's going on at the federal level, does not impact where we are from a state mandate perspective. So we do have to continue on following those mandates. That also, with that being said, also with the state of how the federal mandates are and us not getting a final decision from the Supreme Court yet, there is some anticipation that more states may implement their own state or local mandates. So we have to keep an eye on those possibilities. But as it relates to the federal mandate, that's still yet to be determined, and we will keep an eye on the federal courts as well as the state courts and what they may continue to develop and implement. And with that, that's the current update of the federal mandates. Thank you.
Thank you, Brian. Excuse me. Thank you, Brian. So that leads us to our Q&A portion. I know that we already have lots of questions in the chat. Before we go to that chat, Mary, I'm going to start with, we got several questions before we even started the town hall today. So let me start with Mary, and then we'll move to the chat questions.
Sure. Okay, I've kind of mixed them up a little bit. So when will RHD COVID-19 protocols be updated online?
As I just said, that's going to be sent out this afternoon.
Great.
And June, I think to confirm, you said you're going to send an email and then they can also get them on the website. Thank you.
Programs are struggling with staffing. Why doesn't shared services staff work out of programs to provide additional staffing support?
Not sure who that one
Can that
goes
be
to.
clarified? I'm not too sure what that means.
Yeah, I guess if the person who asked that was the question, I'm not sure.
I think the question in right is, can we in shared services work in the programs? I'm assuming we'd have to have some training, maybe Brandon or Lyndon.
Yeah,
I
I
would
think that-
assume that would have training, yeah.
Yeah, I think the goal, of course, is that we work through our supervisors to identify our staffing needs, right, with your schedulers. So each program knows their own specific staffing needs. And we have had folks in division, and it's also been talked with shared services folks who might be interested in helping us to staff positions. So maybe not everybody has received those phone calls, but we did have a targeted campaign here some time ago to reach out to shared services folks to see those folks who were interested in doing some cross training. But yes, there is a full battery of orientation and onboarding that would need to take place before anybody would be able to work those shifts. And that has been arranged for some of those folks. But there is no specific expectation outside of your job responsibilities for folks to do that. So let me say, number one, we want the best trained people in the programs working with our folks that know and recognize those folks. So that's important to us from a best practice. But we know right now with our staffing and the pandemic, we're not in best practice mode all of the time. So I appreciate the question. And I would say to you that our shared services partners, as well as our division partners, are willing to work alongside you and help out. And those who have stepped up are in process of that or have done so. And we appreciate those folks who have done that with us. So I would, for the person who asked the question, definitely work with your supervisor to think about that question and more broadly brainstorm other options for staffing as well. One thing I might add as an end is HR team have stepped up with us and extra recruiting efforts for us as well. We've also enlisted outside supports for contracted recruiting. So we're really ramping up the recruitment efforts and have for quite some time. And then lastly is our retention efforts. We ask you to help us be good team members, to respect and support your peers, as well as, again, brainstorm together, think of other ideas, ways to appreciate our staff and lift them up when they're working doubles 3 days or 4 days or 5 days in a row. We really need to appreciate and respect and help with that retention effort as well. So it is a joint effort. And I would say to all of you, thank you for the way that folks have stepped up to help us with our staffing needs.
Thanks, Brandon. What can we do when a member's family does not give permission for their loved one to mask, get tested, or get vaccinated who lives in our RHD program? How do we keep their roommates safe as well as our staff?
So I will take part of it, but also ask Brandon and Bernie because it sounds like from the question that may apply more to IDD because in most BHH programs or in our health centers, people don't need somebody else's permission to get vaccinated or tested. You know, they make those decisions themselves. That being said, there is still individual choice in programs. So somebody could decide, I don't want to get vaccinated in a group home. And that we have struggled with that as we have searched for 2 years for what is the safest and best way to provide services. So what I would suggest, because we do so many different kinds of things, is for somebody to raise that individually with your regional service line director and even up to me if possible, if we need to brainstorm, if we have a situation that's proving difficult. And then I'll just ask if Brandon and Bernie wanted to add anything else to that.
Yeah, I don't have a ton to add myself other than to say any opportunity that you can take to help educate or lift up some positive vibes to being vaccinated. Obviously, that assists us. So some families, some guardians are really hesitant about listening to those or having those conversations. So I wouldn't want to put, you know, our team in a bad situation with families, but it is important that we continue to stand our ground on what is safe, educate folks on the vaccine process, educate them on the benefits of being vaccinated. And I know we're talking about masking, but educate them on the benefits of masking. What, again, the W is washing your hands, keeping your distance, masking and taking safety precautions. So I think all of those things we want to educate our folks on constantly, in maybe slight ways. So it doesn't have to be set them down and go through the list, but just continue to educate and reinforce the importance of our safety, of our COVID protocols. And if they realize everybody else is doing it around them, we can hopefully influence them that they too should work toward the safety of not only themselves, but to others, because they bring that impact to our programs.
Can I jump in for a second? I also want to reiterate the possibility that, the residents may be saying no because they're not understanding, as you said, Brandon, but I do think it's the approach. And I do think when we need clinical help, we need to go ahead and call for it, because there's been many instances where folks are thinking that their Decan 08 shot that they get to help with their mental illness is that vaccine. So at times you may need to call on some clinical help to help you in the process and in the approach. We may not know, we may not be able, those who are non-clinicians may not be able to get to, the nucleus of what this person is talking about, or, you know what I mean? So just know when you need to call help, please do.
When the pandemic began, we were informed that only essential travel would be permitted. Has that policy changed?
Yeah, this is a very, regional, region by region decision, because we are looking at the CDC numbers for each area. So globally speaking, we are still discouraging folks from travel. So it's not a mandate that no travel is allowed, but it is something that you need to discuss with your supervisor and need to be aware of the numbers for that region and what's going on. So there will be cases where travel is allowed, but in general cases, we are trying to reduce or limit the amount of travel for the safety, again, of both the staff themselves that might be traveling, as well as those they may encounter along the process of their journey. So again, please consult with your supervisor for your specific state or region, and then the supervisor will help you make that decision.
The CDC, as part of their site, has a chart that lists county by county if you're moderate, low, or high in terms of infection rates in the county, and we're using that as a guideline. We were looking at trying to do QA visits in person, but before we do that, we're looking at what's the infection rate in that particular county, and if it's high, it's clearly not safe to do that. So there is a CDC, and through some of the State Department of Health, there's guidelines out there telling us what the infection rates are, and that's guiding some of the travel decisions.
I just wanted to add to that too. Remember that that standard of only if necessary, that doesn't change, but what becomes necessary changes. So if the pandemic were to last 6 months, maybe a need to patch a roof, for example, might not be necessary in an emergency, but here we are 2 years later. And so now we're facing the prospect of needing to replace a whole roof. So you're going to do the analysis on a case-by-case basis, which is why I fully support and agree with Brandon that this is definitely a conversation. What may have not been necessary in June may now be necessary. So definitely work with your leadership in that regard.
Okay,
Thanks.
so
You still have more questions, Mary?
oh yeah, for sure.
Well, you can take it for, do one more, then pass it to me. So
Okay, great. I've been getting this question a lot from folks. So with the number on with the numbers on the rise of those fully vaccinated and or boosted getting COVID-19, are there any plans to have everyone test for COVID, especially with the CDC lowering the isolation and quarantine times for folks?
know if that's a testing person, a protocol. Not sure who grabs that one.
I don't know that anybody has particular knowledge, but I will say what we've all kind of gotten comfortable saying is that nothing has been pulled off the table. We are in a constant state of flux with this. So things change all the time. So in terms of the question of whether in the future could it be that people who are vaccinated to get tested, that's we simply don't have an answer for that at this time. However, if you have been exposed and you want to get tested, we are absolutely fully in support of using whatever means necessary to stay the transmission of the virus.
And to, oh, and to remind folks that we do have a testing site at 4700, and just register, and anyone as long as you're staff, you can be tested at any time that you want to. Just look at the instructions on how to do it on the COVID site.
Thanks, everyone. So I'm going to start reading some of the questions off the chat, and I'm just going to work backwards and work my way up. So June, following up to my masking questions, how long would the person need to wear the KN95 mask? So that leads me to believe there's a bunch of masking questions. I think, June, you've already answered some of those. So maybe just walk through for those that may be on the phone, right, or missed your other questions, maybe walk through the masking in full.
The CDC guidance on the KN and N95 mask wearing is for when you've been directly exposed to someone, you don't have symptoms yet, you're vaccinated, you come to work, you wear that KN N95 as a precautionary measure, unless you develop symptoms, then you do not come in. Also, the KN N95 masks are worn by people at a program when there are consumers, participants at that site with active COVID-19. So you're working directly with somebody in that care. They have not mentioned anything else. As far as being asymptomatic, I did mention that when I was talking. You have the 5 days, you come back to work with a KN95. If you don't have symptoms, you can go back to wearing the surgical mask. Some people like to double mask that one. That's perfectly acceptable. If you're out in the community, the CDC still has recommendations that you can wear a very thick cloth mask. You're not being exposed to someone with COVID-19 directly. That's perfectly acceptable. They have a lot of really good masks now on the market that are very thick cloth masks. They're not the paper, they're not the KN95, but they are very good at keeping those droplets secure away from you and yours away from others. So again, that's perfectly permissible and according to their guidance. I hope that answers your question.
Great, thank you, June.
We also want to recommend that you please check your supplies. You have that 3-month supply, emergency supply at programs of all PPE. Thank you.
So I'm going to read out the question that just came in. I think we also already have a lot on testing. Peter is kind enough to copying them right now and put them in categories. But in the meantime, thank you, Peter. I'm going to ask this question, but if you've seen other questions about testing, please address those as well. So how accurate is RHD testing turnaround? At one site, we had staff get tested at the end of December and never got results. Multiple inquiries has to be sent before response happened. They were told now not valid and need to redo, but error was not theirs. So I think that's just, again, one of several testing questions. And I don't know if Sheena is on or who's taking testing today.
Hey, Sherry, I'm sorry, what was the question?
So it's about the accuracy of the testing turnaround. So we had a staff member who never got their results, had multiple inquiries, and then
Okay, got you. I see the question too. So we started testing for the testing site at 4700 was the Hicken. We started it the week of December 20th. And if you're following the news nationally, you probably saw that nationally labs were inundated with testing. There was a surge. So the lab we use is no exception. They had a surge in tests. So if you tested that week and the week after, the week of the 27th, there was a major delay in receiving results. And there are some people who may have tested on the 28th and 29th who may not have received results still to this day. There is an email address. I'll put it in the chat where you can inquire with the lab. Since then, they've hired additional staff. Beginning on January 3rd of 2022, their turnaround time is back to normal. So if you test, you should receive your results within 36 to 48 hours. The surge was just something that unfortunately they couldn't keep up with the demand that was happening. We did ask for better communication. So if there are any in the future, if anything like occurs again like this, to communicate with us better so we could communicate with staff better, as we, told them that delay in test results severely impacts the ability for a lot of our staff to work. So if you have any questions about that, you can reach out to me, email me, but I will put the email address to reach out to the lab directly in the chat.
Thanks, Sheena. I'm going to keep going with some testing questions.
So can I, Sherry, 1 second?
Of course.
Can I also say that if in fact you're tested and it doesn't come back in a timely way, don't, that test that you took is now useless. I mean, you have to go in and get tested, and it has to be on the same rhythm that you're on. So if you don't have your testing back in a week, you just go ahead and get tested again. Just get back on your cycle and get tested again. But we're hoping to do away with all of the slow results. We have a meeting with the lab today, so I just want to, because there was some folks that's, they still wanted their results, even though the results were at that point very old, and very old meaning a week and a half old.
I'll also pop in and add this one thing. We're still piloting the company we're using. So we're in the 3rd week now. We're giving them some grace for those first 2 weeks. So it's still piloting. So please, if you have any feedback, any questions, anything, that you want to bring up to myself, Bernie, or Sandy, please reach out to us and let us know, because that determines where we move forward. And, we're actively looking at other options. So this isn't the end all, the be all, just because we have a lab. We're actively looking at other options to make testing more accessible, not just in Philadelphia area, but for our employees nationally.
Thanks, Sheena. I do want to add, I was tested Thursday morning and I got my results on Saturday morning. So it gives me some hope that turnaround times are starting to improve, and that is from the 4700 organization. So I'm going to stay with testing. I'm hoping I've given Peter enough time to bucket some of the other things. Sorry, I know I saw one about home test. So we might want to address it. As far as I know, home tests, we're still not considering them for testing. Sorry, I had the question and just jumped around. So give me one. Here it is. Oh, no, that's not it. Here we go. What is the person to do about testing if they can't get to the main office due to transportation barriers, but also cannot secure an appointment on time to do the weekly testing, especially for those that have to test twice a week?
Is this
Okay.
specific to the testing at Philadelphia? I'm going to assume for Philadelphia testing. So if you have trouble getting to the testing site before outside of the hours of operation, like maybe you work until 3, you can get here at 4 due to traffic, reach out to us. That's something that we need to know, because we may need to adjust hours, if not every day, on specific days of the week. So just continue to give us that feedback. Unfortunately, right now the hours are set, for what they were, and that's for purposes, for the office, the operational hours of the office, and the people who are doing the testing. But it doesn't mean we can't explore options in the future.
Right. I think jumping on that point, Sheena, I think that you should look in your area where you live, the CVS's or the Rite Aids, or to find out who is actually doing the testing. If you cannot get to us right now, you may be able to get to something that's closer to you. So I do think that Rite Aid and CVS are doing it. You just have to make an appointment. Now, I guess it's tricky on whether or not you can do it every, twice a week. If somebody is using CVS or Rite Aid, I'd like to know, how that's going. But, just understand that that could be an option that's closer to you.
For areas outside of Philadelphia, the 2 mandates that we have currently are both in the state of Delaware and Connecticut, and their mandate is weekly. And like Sandy said, the local pharmacies are offering testing, both in Connecticut and Delaware. There are pop-up sites also that are doing testing. But we understand that everything depends on resources. So like Sheena said earlier, if you're outside, if you're either in Philly or outside of Philly and you're under a mandate and you're having a problem getting testing, reach out to us and we will try to troubleshoot with you and your supervisor.
Yeah, I'm going to encourage that person to reach out because it sounds like they are, from their question, having challenges. So please reach out and get support on how to get that resolved.
Sherry, can I add one just last follow-up to testing at the office? I received some private messages. Someone asked about rapid tests being available, like being administered at the Philadelphia office instead of the PCR tests that take, a few days to get the results back. So that is something that we can look into.
Great, thank you. So Peter, I'm just going to check in. Were you able to put some things in categories, and maybe we can go to another category of questions so we're covering everything?
I was, yeah. Most questions are about testing right now,
Okay.
and home testing. There are a couple outstanding questions from early on in the chat that I think have gone unanswered. I'm sorry if they were answered, but I do want to pose really the first one that came in, which is, I think, for June and Brian. And again, sorry if this was answered already, but the question is, what is the breakdown between vaccinated and unvaccinated staff amongst the reported cases? Are we keeping track of that? If not, given the current climate that vaccinated people are testing positive as much as unvaccinated, shouldn't we be keeping track of that, especially given the testing that may be required?
Yeah, I think that's Sheena and Brian Joel were vaccinations, the categories.
Okay, I'm sorry.
Yeah, we don't. I think something was sent out about that.
You know what, Sheena, do you have the numbers? I don't.
I think the question is, are we tracking by unvaccinated and vaccinated as a part of that question?
Yeah, that's really the question. Amongst the reported cases, are we keeping track of, who is vaccinated, who is unvaccinated among the reported?
Amongst the reported cases, we have not done that because our form was not just recently adjusted to do that. So going forward, we could try to do that. But no, we don't have that information. We do have vaccinated, unvaccinated, but not as it relates to cases.
Okay, thank you.
Yeah,
We'll
go
be
ahead, Sherry.
sending out a revised fillable report with that to capture that information. We just worked on that on Friday, so that should go out as well this week.
Okay, thank you. Another question that I couldn't really categorize that was early on in the chat. Has RHD considered requesting from the mayor to make more quarantine space available? So I guess what's actions around available quarantine space?
I can say we have not done anything formal to request that. Generally, the programs that I am familiar with that needed quarantine were able to locate that. So somebody can reach out to me or Sandy or the service line director if there is a problem right now with quarantine space.
Okay, thank you, Linda. Yeah, and I know one participant here had a lot of questions about testing. I don't know if you would like to come off of mute to ask those questions, but a lot around, yeah, really accepting home testing, related to issues with getting appointments twice a week. What is someone to do about testing if they can't get to the main office due to transportation barriers, also can't secure an appointment on time to do the weekly testing, especially for those that have to test twice a week?
I think that's Sade, and I was answering
Yeah.
her some of her questions in direct message. I don't know if she wants to come off, but pertaining to the transportation issue. So that's for, I guess, anyone who maybe is having issues getting to a testing site. Maybe there isn't one near their home or work office locations. So I would say to anyone who's having any difficulties either locating a site with transportation, please reach out to myself, Bernie, or Sandy, so we can look at options, resources available. We don't want, the failure of not reaching out to be a barrier to why you're not getting tested. So if anyone is experiencing any, difficulties at all, reach out to us so we can see what resources we have available to support you. What was some of the others, Peter? I'm sorry.
I think most of the other ones, Peter, we have addressed, I think.
I think so too. Another one was, which I don't think has been answered yet, is there a written policy regarding the number of times employees can miss testing mandates before being permanently removed from schedule?
Okay, so I'm not sure for Connecticut and Delaware, their mandates. I know for Philadelphia specifically, we did not include a specific number of times. That's something we can revisit because it may be specific to that program, and one program, may have room or enough staff, or one exception, or different things, different circumstances could be the reason why. But we can re-look at all of the policies around that and see if changes and updates need to be made. I don't know if Bernie wants to speak.
Yeah, I would just jump in and say that, there's no specific amount of times. Clearly, it's something people need to do, but we're not going to put in a specific number of times you can miss because we don't know why you missed. Okay, so it's something that you would need to work through with your supervisor and with HR, because you may have, a very legitimate reason for missing a test. It may affect your availability to work, but a lot of this is, generalized questions for very specific situations. So I will recommend that you deal with your immediate supervisor and they would deal with our HR business partners.
Thanks, Bernie. Peter, I saw one, and then I'm going to pass it over to Mary because she's getting the slew in. But one last one with testing. If you are fully vaxxed but do not have the booster, will you need to test weekly?
So, everybody, right now, in terms of what fully vaxxed means, June also clarified in the chat, that is the CDC recommendation for the purposes of satisfying the mandates we're currently under in Philadelphia, Delaware, and Connecticut. We are using their definition at this time, their definition of fully vaccinated, which at this time is 2 shots of Moderna or Pfizer and 1 shot of J&J. As with everything, that could change, and hopefully we'll have plenty of notice. But right now, those are the places we're mandated, and we're using those mandates as our guidance in terms of what fully vaccinated means.
Thanks for clarifying, Stephanie. So I am going to pass it to Mary, who has gotten many questions.
Yep, some questions about working from home. Are we allowed to work from home while we quarantine once we test positive and do not have any symptoms and feel well enough to work? As a follow-up to that, someone is asking, since home tests are not being accepted and there are issues with getting appointments twice a week, is there an option to work from home if feasible?
Take part of that question. There might be others that have pieces as well. There's some jobs that are required on site, that the work can't be transferred to home. There are some jobs that perhaps might be, but that's really a question with the director, the HR business partner, the regional and service line director. So I can't give a blanket statement, but many, and I would say, for all of our residential sites, many of our mobile, they are in-person services that need to be done on site or in person.
Okay, thanks, Linda.
Can I just add one other thing? I think that, again, out of that, what should be maybe heard for everyone is that's a conversation that should happen with your director or your supervisor, just because, again, RHD, I think it's easy to kind of maybe see RHD just through the lens or the perspective of the area in which we work or the program or the department in which we work, and forget that it's challenging to have one uniform answer corporate-wide because of all the differences and nuances across the corporation. So again, it is important to make sure that you are in communication with your director, whether that's a program director or a shared services department director. Either way, it's important to make sure that you stay in contact with them regarding what the needs are, and they will work with your HR business partner around that.
Can workers with an exemption receive a letter from RHD stating we're exempt from the vaccine?
Parts of that question are unclear to me, but I will say this. Your exemption is really only asked to RHD. In other words, RHD did their legal analysis and did their human resources analysis and have passed on that exemption. I don't know whether you would be exempt according to the state, to any state, according to the state of Connecticut. It is specific to satisfying our commitment and our responsibility to those areas that mandate. So for Philly, Connecticut, Delaware, we are more than comfortable that that exemption is in place. So I'm not quite sure. My answer's tentative because I'm not quite sure for what purpose. And if someone was to clarify or ask the question, with an eye specifically to their needs, they can either do that here, or you can, of course, always reach out by email.
Yeah, I'll see if any clarity comes through
Okay.
your voice. But while I have you, I know you just clarified this, but there still seems to be some confusion about if we need to put our booster information into Okta or not yet.
There's no setup yet for that to accommodate that. So we can't have you do it if we have no setup yet. I know that there's talk about revising it and it's revisable, but that has not been concluded yet. And more will come out about that, I'm sure, this week.
If you don't mind, June, Mike Ryan is in the meeting. And because this is something that is in development, daily, I would like for him to answer because I don't want to add to that if that is confusing. Mike, I don't know if you have the ability to come off mute, if you guys can unmute Mike Ryan, and maybe Mike, you can speak directly to where we are with that, because I don't want to share if the information is not the most current and if what's been shared so far is accurate.
Good afternoon, everyone. This
There
is
you
Mike
are.
Ryan. I'm here. So we were anticipating this need. We have the data collection set up. It's not currently available. It's not turned on yet, but we have it set up to collect booster information. It will be, when we do turn it on, it will be part of the regular vaccination form. What you'll have is where it says vaccination status and you currently select either fully vaccinated or partially vaccinated, there will be an additional option, booster, and you'll fill in the information for a booster, very similar to how you would fill in the rest of the vaccine information. You'll provide the you'll select who the vaccine manufacturer is, whether it's Pfizer or Moderna. You'll enter the date of the vaccination. You'll enter the lot number of the vaccination, and you'll check the box to say that the information is accurate, and you'll upload a copy of your vaccination card that shows that booster. If it's someone that is coming into this, like coming into our data collection process where they've not entered anything yet, and so they need to do their full vaccination and their booster, entering a full vaccination and a booster is two separate entries. So they'll enter their fully vaccinated information first, basically the first two injections or a J&J injection, and then they'll enter their booster separately.
So it's in development, just not yet launched. So we've got it.
Correct. Yeah, we're waiting on.
It's not launched yet.
Yeah, we're just waiting for the communication to happen, because we don't want anyone to get confused in this, because everything's fluid and potentially confusing enough already.
Thanks so much. Appreciate you.
And sorry about that, Alicia. Hopefully not adding to the confusion. Recall that our ability to put in booster information may or may not come with a requirement to do so. So we may be able to do it and not be required to do it, or we may be able to do it and we may be required to do it. So I just don't want that confusion. You may get an email that you can now add a booster to the documentation, and that may or may not be something that you are required to do, just so that we can all kind of stay on the same page together.
Stephanie, I would just add one more thing, because I saw the follow-up question around, if the booster is not required, why do we need to upload the proof thereof? I think, again, the goal is one day, I feel like Martin Luther King, and I'm channeling him, one day RHD will be ahead of the curve and proactive and not wait until after the fact. And so the same reason why we didn't necessarily have a nationwide vaccination requirement, but we asked employees, if you already have your vaccination, to please enter it into the system, because it allows us as an organization to operate ahead of the curve rather than always kind of running behind it, trying to catch up. If we have more people that have put their information in, that information can be validated, and then people aren't all flooding it at the last minute and then waiting at the last minute for verifications to come through, when there may be like one person trying to do all the verification and everybody's impatiently waiting for their verification to come. The more we get ahead of time, the more we have the ability to validate. You get your verification, everything's good. And then we wait for our wonderful, we call them in my family, our cousins that we know are going to wait until the last minute to show up to the party. So if you have the information, once that site is launched, we would ask that you be proactive and put that information in, so that you're not adding to the fray of everyone waiting until the last minute to get your verification and stressed about your ability to still remain working and on shift and so on and so forth. So the early bird gets the worm in that situation. Well, we're not ready yet, but know that it's coming.
And if I can just jump in for a second, related but unrelated topic, wanted to just give a shout out to our program leadership over the past couple of weeks in making sure that we have everybody's vaccination status that is required, an RHD requirement in the system. So appreciate all the effort of our program leadership as well as our staff in following our process to, again, as Alicia said, be ahead or try to be ahead of the curve and have that information so we could continue to plan and proceed with our response to the pandemic. So thank you, everyone.
One last question for now with through your voice. Curious if the numbers are significantly up from this time last year. Why isn't the office operating under the same way as last year, meaning essential employees only?
Not sure who should answer that one. Could someone jump in there?
I don't know who is to answer that. I don't know that there's any one person. I'm not really sure which office we're talking. I'm assuming when we say the office that means 4,700. I'm not sure. I don't know that we have adjusted 4,700 from essential services staff. So I don't, not sure who is the best to answer that question. I saw June come off mute though.
Yeah, the opening committee did look at a lot of these issues and whether we were coming back and when we come back and what it looks like. But again, like you said, we still are on essential staff coming to work.
Thank you both. Mary, I'm going to take one here that from a while ago, but I think it feels a little different. Because we are not able to keep our residents separated, is this preventing people from fully recovering? Again, not sure who takes a question like that.
I would just say from a programmatic standpoint, we want to do everything we can to keep folks as safe as possible. If there is a situation where we can, and it's indicated that we remove folks from a particular site, then certainly we would have discussions to do that with the team. But in most cases, it is not advantageous or any additional safety offered by removing someone from a site. So it really depends. It's a very specific case-by-case scenario with that question. I apologize not to be a more in-depth explanation, but certainly we would have to walk through every case as an individual, because we have had cases where we've consolidated folks even, which sounds like why we do that, but certain cases we do that. Certain cases we have removed folks from a site. So we are doing that on a case-by-case basis. So I would just say, please consult with your team or your supervisor if you have specific questions about your particular consumer that you're caring for or your site. And we can work through that with your team to manage the situation as best we can. Because it is our goal to be as safe as possible and to prevent the spread of any infection to others.
And it wouldn't hurt to have that discussion before something like that happens. Sort of like, what are we going to do if someone, so, I mean, that's one of those things that you can, prepare for to some degree. So just as a group, maybe in your monthly staff meetings, that might be, a nice topic to discuss, thinking about all the houses that you have, we're thinking about, how long the person will have to be quarantined, if there's a hotel nearby, or, a number of things. It would be great to have that plan in place so that you're not scrambling, so have a conversation with each other, maybe during your staff meeting.
Thanks, Sandy. June, based on you're answering these, but based on some of the questions, it might make sense to go over these COVID protocols again. If you have symptoms, if you don't, if you're vaccinated, if you're not vaccinated, since there seems to still be a lot of questions. I know you're answering some of those in the chat, but I try to remember sometimes people are on the phone. Would you be willing to go through that again, June? You're on mute.
It depends on the circumstances. I don't want to take a situation out of context. If you've been exposed to someone with COVID-19 and you're vaccinated, you can still work with the KN95 mask unless you develop symptoms. If you're unvaccinated, you need to do the 5-day quarantine. If you don't have symptoms, you can come back to work with a KN95 mask. If you do develop symptoms, anybody who has symptoms, vaccinated, unvaccinated, exposed, not, cannot work at this time unless they're symptom-free for 72 hours without the aid of medication. I hope that, I'm trying to simplify it for people, but.
Yeah. And June, am I correct to say that there is a chart in the new protocols that really helps them see, like if I'm vaccinated?
We're going to send the chart out. The
Okay.
protocols have been adjusted so that it's still the scenarios that we're accustomed to. And the verbiage has been changed in each one of those slides. With the chart will be sent out separately.
Okay.
It's just another tool to kind of take a look what you can do at home. If you have to run out to the store and you got to put your KN95 or that, whatever mask you have, if it's, you still got symptoms, but it's after 5 days, you can't come to work, but you might be able to run to store with the mask on to quickly get an item that you really need. Again, it's taking into consideration those work-life activities, getting a better balance, but still within the context of the safe activities, keeping yourself safe, everybody safe, who you come in contact with.
June, I see a question that just came in about the symptoms, like loss of smell and taste and coughing can linger for months. Does that mean the person cannot return to work until those symptoms disappear?
I would have to look at those things on a case-by-case basis.
So I just do want to hop in. The biggest symptom that needs to resolve is a fever. So when you heard June talk about 72 hours, it's really 72 hours of no fever. And then I would add in the cold symptoms, congestion, sore throat, and cough. Those are probably the biggest symptoms that should resolve before returning to the office.
We don't want those aerosolized droplets to become loose and infect people. So the coughing, the sneezing, those things are concerning, the congestion, any respiratory issues. As well as fever, sorry, to indicate an active infection.
Thank you, everyone. So let me check in with Mary or Peter. I'm guessing there's some that I've missed in the chat. Mary, have you gotten any additional ones? No additional ones.
Yeah, I did have a private message come through to me, which I think has been answered at this point, but I want to confirm that it has. And I think the answer is no to the question, but the question is there a deadline for meeting the new fully vaccinated definition, which is also having a booster?
I think Alicia spoke to that.
Yeah, I think Stephanie spoke to that as well, that we have not yet required that the corporation, and we are, while you're getting it, of course, make sure that your information is legible, because we are anticipating that information will need to be entered into the vaccine data portal that's in Okta. It has not yet been launched, but it's in development and in testing and should be soon forthcoming as soon as we work out the communication. So no requirement as of yet. Yes, we are anticipating that it will be forthcoming. So if you're getting your information, luckily, I just got boosted this morning and they're actually now sticking the label onto your card rather than writing it, at least where I went, so that we don't have the vaccine lot number legibility issue. So get your boosters if that's what you're choosing to do. Get your boosters. We do anticipate that will be forthcoming. So not yet.
Thank you, Alicia. And yeah, another recent question that came through the chat: with cases up even among those fully vaccinated, are there plans for the central office to offer more remote work?
I'll speak to that again. That is something that you should be having conversations with your department and or program leadership about. There are still individuals who are working remote. Again, as June shared, there are some whose work itself does not, or Linda said, there's some whose work does not allow them, and that's both in a program as well as there are some shared services teams where the work does not allow you to do that work remotely, or requires you to do it only partially remotely, and some of the work has to be done. So directors and managers have been working that out. So again, understand that there are differences and nuances within, even across departments at times, that would require the employees to have those conversations in your team meetings or whatever the case may be with your directors, your supervisors, to make sure that you're clear about your work requirements as well as what other resources or options are available to you to be able to continue to maintain your work demand and productivity. And I say that understanding that there are many departments and shared services that are struggling with staffing shortages as well, and are struggling with some crisis around their own staffing, so that also has to be factored in. So again, just encourage you to talk with your department leaders about that.
So Peter, I'm going to take this one because I think I may have seen this for the second time. The RHD IT Minecraft security. How do you add an improved provider email or organization so information is not delayed or not read? I don't know if this relates to the test. I know my test results fell in that, so I'm not sure if it relates or not, but I had to go through that process. I don't know if we have anyone on the call that could talk to that. Maybe Mike. I'm thinking Tara's not here today. Could you talk to that by any chance?
I don't know if I can answer it directly, but Sheena, if you're still here, hopefully you're still here, because then you wouldn't hear your answer. Can you are you talking about sending emails in general, or is it, as Sherry seemed to indicate, relating to something? I'm not sure what specifically you're referring to.
Sheena, if you could put clarification in the chat, that would be great. Sheena Costello.
Can you hear me?
Oh yeah, there you go.
Yes.
My question is in regards to, in general, emails that have nothing to do with the COVID situation. That's enough on itself. The question was, because we have outside funders with the city of Philadelphia and other organizations that work with our participants, we communicate through email. And since the Minecraft has been created, they have not been able to receive some of their information. And then also some of our participants that communicate with their case managers are not savvy enough to really set that system up for themselves on their end. We talked to a provider today that mentioned, I had her go through the step process on how it looks on her end, on how she had to access that or create a password or what have you. And some of the participants might not be that savvy to be able to learn how to do that. So that was where my question was leading to outside funders or other organizations that work with participants and case managers. How are they to access information if it's blocked?
Gotcha. I think you're referring to the encryption of email
Correct.
going to external. Okay. So there's a couple there's something that you can, so if you need to email in the clear, without encryption to an outside recipient, all you need to do is add X as in xylophone, T as in Tom, P as in Paul, XTP in all caps to your subject line. You can just add it to the end, just put a space before it. And what that'll say to the email system is, do not encrypt this email. And then any communication on that, like any replies that come back in and go back out, because they have that in the subject line, that thread of communication will not be encrypted. However, I'm obligated to remind everyone that if you are sending anything that contains PHI outside to an outside recipient, you do need to encrypt that information to protect that PHI. So does that answer your question?
Yes. So that you're saying that it's basically based on each individual email to make sure that it's noted that way.
Yes.
And you will not be able to just override for an organization or an entity at all.
I don't think so. Let me check with let me check with the appropriate resource on our team, and I will either respond back if I get an answer during this meeting. I'll respond back in chat, or and at the very least I'll email you.
Thank you very much.
You're welcome.
So, a lot of people have actually added on to this, so please know what we will do today is take all the questions, we will put them into categories, and certainly one like this, we'll make sure communication comes out to clarify, because I think this is pretty new to the organization. So just know that we probably can't answer all those questions today, but we, again, will categorize them and get back to you.
Yeah, I appreciate Sherry, you sharing that and observing that and sharing those next steps with the community. And I would also ask towards that, in addition to the questions and the confirmations being shared here, I would ask that staff, programmatic staff, administrative staff, begin to talk to your supervisors, your directors, your leadership about what you're experiencing. I would ask those folks to make sure that you are corralling that information and sharing that with our technology leadership, including Tara Drennan, so we can, as an organization, determine how we want to proceed further.
So thank you, everyone, for putting that on the table and putting the additional comments in there. I'm going to check in with Mary and Peter. I see Mary shaking her head no. Okay, and see, I can't see Peter anymore. Yep, now I see you. And
Yeah, I'm here. Yeah, the other questions, I guess, yeah, are kind of related to, yeah, the auto encryption and whatnot. So I don't have anything outside of that.
Okay.
Sorry, I got 2 more questions.
Oh yeah, sorry, Sheena. Thank you.
I got one question about, is there a central-wide on-call staff list that we could use to cover shifts when we have lots of staff that have to quarantine? I don't think so, but that may be a good idea for programs that are close in proximity. Maybe we could talk to the program leadership and divisional leadership about creating that. And second, for people getting tested at 4,700, can the office give proof that we were tested and that we are waiting for results? So proof of testing still isn't your proof of results. So proof of testing still, unfortunately, wouldn't make a difference and doesn't impact your ability to work. You do have to wait until you get the results.
As far as the staffing question, yes, it's a great idea that we are doing. The difficulty, as you can imagine, if you cannot staff.
I'm just trying to turn the volume down a little bit on my,
Sorry about that. Maybe it was the delay. And so that is the idea, and the goal is to have that PRN staff pool. We've worked with the programs and with HR for quite some time to work on those. There, as you can imagine, and as you are all, most leaders on here would recognize, that's a difficult task to achieve. Easy to plan on paper, difficult to achieve that when you're competing with other folks who have multiple jobs, as many of our folks do. So our goal is to be the employer of choice to maximize the hours that employee would spend with us. And if that's through regular routine schedules, or whether that's through their on-call participation, we definitely want to do that. So I appreciate the ask. And again, would advise you to talk to your supervisor at your program if you're not aware of the attempts to establish that, because almost every program by now, if they haven't, should be working on trying to have some backup supports to our folks. But I'll be honest, the priority are just working to fill the shifts, period, while they work on that. So I appreciate the thought, the idea, and the question.
Thank you. I see one question that maybe we haven't touched upon, but the question, the answer. If we got vaxxed at FPCN, can FPCN reissue cards if lost or damaged? The answer was we can certainly help you get an updated vax card, and to email e-nichols@FPCN. But I'm thinking more broadly, if this is a problem for folks outside of Philadelphia, as I imagine that could happen, I would reach out to your provider to see if they can help with that. All right. Hopefully we have hit all the big categories. Again, we absolutely this week will take the questions, put them into categories, make sure we respond. So with that, Marco, I'm going to turn it over to you.
Thank you, Sherry. I feel like, with all that we have in front of us and the questions that are probably still lingering as we end this call today, whether maybe not fully answered or needing more information, or maybe we missed a couple or a few. I think what would be helpful for all is if we just take a moment to take a deep breath in and exhale together. And know that as the music that kicked us off today was reminding us, life is a highway. It will have its dips and hills and its curves, and I think we have experienced them along the way. And I think, like those of us who drive and know how to drive, and the saying of, let's approach this like driving a car, as easy as driving a car. How do we get to that place together? And I think that's key, is continuing to voice your questions, your experiences, your scenarios, so we can continue to drive this car together down the highway. So I ask you to keep them coming. Continue to look to each other for direction and guidance. And we will find ourselves at a place where some of what we are experiencing today that is challenging and filled with questions, that it becomes, hopefully, as we move forward, like driving a car. So with that, I thank you all for joining us today. Stay tuned for any follow-up communication from this meeting, and have a great rest of your day.